My name is Sarah Cogle, and I'm a clinical pharmacist specialist at Vanderbilt University Medical Center. Today's topic is just one in a series of subjects brought to you by Channel 1 On-Demand Nutrition Education. Today, I will be presenting on PN Quality Matters, Smarter Initiation, Safer Dosing, Stronger Outcomes. The objective for today's presentation are for attendees to evaluate the clinical appropriateness of PN initiation to reduce practice variability and prevent avoidable complications, to develop programs to analyze PN prescriptions for dosing accuracy to prevent cumulative energy and protein deficiencies and reduce error-related adverse events, and to develop and apply quality safety improvement strategies to optimize PN monitoring, safety, and overall therapeutic effectiveness. The focus of today's presentation is on quality improvement, but it's important to level set at the beginning here to think about what quality improvement actually means in the healthcare setting. And the definition of this is a framework to systematically improve patient care. And the goal of quality improvement or QI projects are to standardize processes, reduce variation, achieve predictable results, and improve clinical outcomes. Quality improvement encompasses all aspects of the healthcare system, from technology, culture, leadership, and all types of capital, including physical, human, and knowledge capital. When we think about different types of medications and processes that quality improvement projects are likely to have a positive impact on, we think a lot about high alert medications. ISMP, or the Institute for Safe Medication Practices, publishes a list of high alert medications which are known to cause significant adverse effects if used incorrectly. Parenteral nutrition is included as a high alert medication, and this is all types of PN, whether it's a multi-chamber bag or a custom prepared PN. But PN is also the only medication on the list that also contains multiple other high alert medications. And your PN that you're working with may not contain all of these, but some of the products that we see that are also on the high alert list are hypertonic dextrose, all types of injectable potassium, insulin, hypertonic saline, and then sterile water for injection as well. Because of PN's high potential to cause significant patient harm and the high likelihood of errors occurring with it, FASPEN has long recommended that parenteral nutrition be incorporated into quality improvement processes across institutions. The 2014 FASPEN PN Safe Practice recommendations recommended that PN quality improvement programs be in place to report, track, and analyze errors, specifically with the PN order review and verification process. And the FASPEN model for developing PN competencies, which was published in 2018, recommended an interdisciplinary quality improvement program that incorporated analysis of medication errors associated with PN administration, and also considering what type of errors that may occur at other institutions, because we know that if errors occur in one setting, they're very likely to occur in other settings. Despite the fact that PN QI programs are recommended, a 2025 PN use survey of clinicians who were involved in the PN use process in the United States showed that many institutions still do not have QI processes, or if they do have them in place, practitioners who write PN at their institution are not sure about what these programs entail. When we look at who responds in most institutions to PN-related errors and adverse events, pharmacy and dietetic services are the disciplines that are most likely to be involved, but medical staff committees and nutrition support teams are also involved. And I think this really highlights the need for multidisciplinary involvement when designing QI programs. So at your institution, if you are considering initiating a QI program related to PN, or perhaps increasing the robustness of an existing program, the first thing that you want to do is to form a working group or a task force. And it is really optimal to have multidisciplinary participation. Essentially, every discipline that is involved in the PN use process, from ordering and compounding to administering the PN, we want to have all necessary stakeholders involved. When you think about what people should be doing on the task force, it is important to have specific roles just to make the framework a little bit more clear and so that people understand which things that they are specifically responsible for while working on the task force. Some examples of roles are a team lead, technical experts, clinical or systems leaders, an improvement advisor, and also an executive sponsor who can be the champion for parental nutrition improvement processes at your institution. The next thing you'll want to do is select a QI framework, and I do have some examples on the next slide that I'll talk about, but I will say that a full presentation on QI frameworks and different models is really beyond the scope of this presentation, so I would direct you to the references that are included at the end of the presentation for more guidance on which framework or model may be most appropriate for you for this specific project. The next thing you'll want to do is determine a specific project, and it really is best to think of perhaps one broad project and then break it down into smaller projects that you can move through. Again, you're not going to come up with, the solution to everything at one time, so you may want to start small and then move from there. The next thing you want to do is engage in quality improvement, so do your project. But then lastly, you want to make sure that you are evaluating the impact of your changes, because if you make a lot of changes, that's great. But if you don't know what the impact is, you're not sure if you've actually affected change in a positive manner or not. So as I mentioned, there are multiple quality improvement frameworks. Two common ones I've listed here are the model for improvement, the PDSA, which is Plan, Do, Study, Act model. Another model that is very commonly utilized in healthcare settings is Six Sigma, and its principles are define, measure, analyze, improve, and control. And again, I would refer you to the references at the end of this presentation for some ideas about the differences between these models and which may be most advantageous for you to use at your institution. When you're thinking about what type of QI projects you could look at, there are a variety of things that you could do. Again, I would suggest starting small if you are initiating a process for the first time. One of the things that you can look at is your PN error reporting process. We saw from the ASPEN 2025 PN use and survey and gap analysis that many institutions still do not have a process for reporting errors at their institution. So if you do have a process, what is that? And, is it in line with what is recommended from our best practice organizations like ASPEN and ISMP? And what is the process for error reporting internally, but also externally? Do you have a process for reporting errors to ISMP? Another thing that you can do at your institution is to compare your current PN use processes to current published guidelines and standards. And so this should ultimately focus on all steps of the PN use process, but it may be more feasible to evaluate steps individually. For example, you could look at how PN is ordered in specific dosing units and if that is consistent with what is recommended in the ASPEN guidelines. And then you may move to a different part of the PN use process later. Another thing that is commonly utilized is a medication use evaluation, or an MUE. So you could do an MUE on parenteral nutrition. This is a great project to get pharmacy and dietetics students involved with, or really any students, especially when they're looking for research projects to present for their clinical rotations. Some of the things that you could look at with an MUE is appropriate use of PN dosing, and this could go through, it could focus on a specific ingredient like macronutrients or electrolytes, or it could look at dosing of all things. And then also, are there adverse effects that perhaps are not being reported in an error reporting system? It is very important to engage in quality improvement, and there are some very helpful references that you can find at the ISMP website and also in the ASPEN Research Toolkit. So I'm going to direct viewers to check these websites out for additional guidance, and my references also provide some additional guidance as you move into doing quality improvement projects at your institution. Thank you so much for tuning in to the presentation today. I would encourage you to watch for upcoming Channel 1 videos on nutrition and to learn more from my esteemed colleagues. Have a great day.